The black lines on the nails are considered normal in people over 20 years old. However, before any unusual spot, it is better to go to a specialist. How often do you visit the manicurist? Gene Skinner works as a beautician in Uckfield, East Sussex, United Kingdom, and a few days ago he shared his story. This made more than one tremble. It all started when one of her clients asked her to put a dark tone on her nails to cover the black line that ran through them. However, Skinner recommended going to the doctor because, in some cases, the symptoms of cancer are presented in that way. The diagnosis confirmed that it was unguenal melanoma, an important cancer of the skin. This type of darker or bluish spots not only appear on the nails, there is also a change in the size, color and shape of the moles. It should be noted that dark spots are not always linked to cancer. These are some situations in which its appearance is completely normal. Consumption of medicines. There are drugs among whose side effects is the pigmentation of the nails after several days of medication. During pregnancy, it is possible that in the period of pregnancy the nails are stained to a brown tone. However, it does not have serious consequences. Infections. The appearance of fungi on the nails causes them to change color. Bruising. When there is a mixture between brown and red dots, it is most likely due to a blow. When should I worry? Although uncommon, nail melanoma can appear in children. The width of the line is greater than 4 mm, and it is not a single color. There are different shades of brown on the same line. It changes as time progresses, and, generally, the skin surrounding the nail is also dark. In most cases, unguenal melanoma affects only one. However, there are symptoms that can occur in different parts of the body, such as the toes or scalp. How dangerous is it? Melanoma is considered to be the most aggressive tumor that affects the skin, as it spreads other organs, including distant organs such as the small intestine, eyes, brain and even the heart. Treatment. There are different ways to treat a melanoma on the skin. Everything depends on the state in which the tumor is located and the physical conditions of the patient. These are some of the treatments. Radiotherapy. With this method they prevent cancer cells from growing. It is a local treatment, that is, it only affects the area in which melanoma is found. Surgery. This technique is the most used, since the tumor and surrounding tissue are removed, so that it does not reproduce in nearby areas. Chemotherapy. Used when melanoma has spread to other parts of the body. The patient is administered a combination of drugs, and even applied locally. Immunotherapy. The goal of this treatment is to increase the amount of defenses in the immune system. Prevention. One of the biggest causes of melanoma is the lack of care when exposed to the sun's rays. In matters related to the skin, the following should be taken into account. Do not expose yourself to peak hours between 12 in the morning and 4 in the afternoon. Get used to using sunscreen every day. Apply it half an hour before leaving, especially when going to the pool or the beach. Drink at least 2 liters of water as the sun dehydrates the body and you have to regulate the temperature. Avoid tanning. Exposure to UV rays accelerates aging and increases the risk of skin cancer. Pay attention to any irregularity. Do not miss the signs. Check if your nails or moles change color or size. Listen to your body. It is very common to confuse melanoma with benign diseases such as onychomycosis or common bruises. That is why patients arrive with advanced disease. So, for health, avoid self-medication and go to a dermatologist for any abnormality. It is the only way to have a correct diagnosis and proper treatment. Prevent reduces mortality.